A parotid. The description was exactly that. It was parotid. Went and saw an ear, nose, and throat, and did the MRI and the biopsy, and that's how I ended up down here. So we found Dr. Larian and Azizzadeh from the internet, and Skyped with them and felt more comfortable knowing that we were seeing somebody who deals with this all the time.
Hello, hi. Jennifer?
Yes.
Good to meet
Nice
you.
to
I'm
meet
Dr.
you too.
Azizzadeh. Hi.
Hi.
Pleasure.
Nice to
Hi,
meet you.
Richard. Great to
Yes.
meet you.
So, your mass is very small, fortunately,
Right.
9 millimeter. And we have the biopsy results, which tells us it's a pleomorphic adenoma. So we know we're dealing with something benign, which already makes everything simpler. The most important things that we do is first find the nerve that goes to your earlobe, the greater auricular. And then once we protect that, we go down and find the facial nerve. Right? And once we find the facial nerve and the branching system is cleared out, when we preserve and protect those branches, then we can go ahead and remove the tumor with a cuff of normal parotid tissues to prevent it from coming back.
Right.
Because the tumor has little finger-like projections on it, so if we have a cuff around it, then we'll be safe in that regard.
So do you send it right to pathology right away and keep checking? Will that be, since you're speaking millimeters, will that leave a divot?
Yes.
Okay.
Yeah, absolutely. And that's why Dr. Azizzadeh is going to do a reconstruction right away to fill in that divot so you don't have any asymmetry.
And what do you fill it in with?
The most common thing that we do is there's a muscle here called the sternocleidomastoid muscle, or the SCM muscle, and we rotate it up into that area where there's the opening. Then we also rotate the gland to make sure that the gland and that muscle are really nice and smooth, and it's created a smooth surface. Usually for the size that your tumor is, that's usually enough. Now, once in a while, we'll also see that, there's still a little bit of indentation. Then we'll use some products, some kind of like collagen fillers.
Stitches, and then do you come back later and take stitches out?
Stitches that we take out from the front.
Okay.
Behind your ear is dissolvable. And if we have any extensions into the hairline for the face and neck lift, those will also come out a week later.
And so the scar doesn't come down here. We had seen at some point, it looked like it
Those
had
are
come
longer,
down.
the bigger.
It's called a modified Blair, and it goes around here,
Okay.
and it comes down here.
Yes, that's the one I
So
saw.
no, we don't do that. And
No, I don't do that at all.
Okay.
Dr. Larian actually kind of pioneered a lot of changes in this whole area where the incisions then used to kind of come down limited here, then we went behind the ear, and that's pretty much, it's kind of like just around the ear.
It's a problem.
Close, isn't it?
It's close.
It'll be fine. We'll remove that, if you don't mind.
Oh yeah, absolutely.
Okay, bring your neck down just a little bit. Yeah, I think that's very, very reasonable.
I do too. I don't want the scary
It's a
type.
No, I think it's a very natural.
Thank you
That's
for that.
that's really kind of not our goal in this operation. Our goal is to create a natural, youthful beauty that's appropriate for you, that hopefully when you go back and see your friends, no one says, "Oh my God, did you get a facelift?"
Right.
They'll say, "Oh, you look great. What did you do? What's happening? You look like you had a great vacation." That sort of thing. And for the next 10 to 15 years, for you to age elegantly.
Because my MRI has not shown up yet.
No, I mean, the
evidently.
description that we have on the imaging studies is enough, but obviously we prefer to see the images ourselves. But it won't be an issue
Okay.
with your size too.
With
this-
my
with
the
size.
small
Yeah.
Okay.
How long do you think the tumor's been there?
It's impossible to guess.
Yeah.
These tumors grow generally very slowly, but the growth rate can be this, or it can be plateau for years,
And
then
then-
you find. So it's really hard.
And
to
then
predict.
boom.
And then it can,
Yeah.
it can take off as well too.
Right.
Yeah. So
That's why we're here now.
yes, of course.
No, it's a good time. If you're gonna do it, you want it when it's small.
Yeah. Yeah.
Okay.
Minimize
Okay.
the-
Yes.
All right.
They make me feel much more comfortable, yes. Like I know we made the right decision by coming down here, seeing people that know what they're doing and see enough patients with the same parotid